Over the course of the last 20 years, the emergency department has evolved from a relatively minor component of hospital-based care to, in some ways, the most significant component of hospital-based care. The overwhelming majority of patients who present to us have the overwhelming majority of their imaging studies, the work done to make a diagnosis and the work done to treat the diseases that we diagnose are started and in many cases completed inside the emergency department. So it is critical for any hospital to have an emergency department that represents the state of the art, and the new department at the Webster campus will represent that state of the art. The present workspace was designed, I think, something in the 1950s. The rooms are small, they're semi-private. It is difficult for the care personnel, the doctors and the nurses, to move around in those spaces to some degree. And so the value of a new facility is it's a much larger space. Each room is individualized, standardized in terms of location of equipment, but they're fully private rooms, and it will allow what is already, in fairness, an extraordinarily gifted, outstanding group of nurses and physicians to then provide the best care in the most state-of-the-art setting. The waiting area is much larger, it's much more comfortable, it will not have to pass through, to some degree, the clinical space, which is the present arrangement. That is, that people who walk into our present department actually pass and partially visualize the treatment areas, and that will no longer be true. So we will create a space that is entirely confidential for the patients who are in the rooms, compliant with state and federal regulations. We're looking forward to opening up our new state-of-the-art facility in the very near future.